tried everything and it's time to get that inevitable knee surgery, the quad setting exercise is one of the first things you'll be taught and focused on in rehab.
We'll start off with your basic quad set, where you're just going to hop onto a bed or onto the floor, have your legs straight out in front of you. Try to push the back of your knee down and activate that quad muscle. You're just trying to get a good contraction to make sure that connection from your brain to your muscle is exactly as it should be and that you haven't lost anything in the surgery. Try to pull your toes to your nose to increase that quad contraction, because the surgery and the injury itself has basically told your body that it needs to shut down. When you have a surgery, your body doesn't know the difference between signing up for the surgery and getting mauled by a bear. So trying to turn that back on to get you back to full function as soon as possible is critical. Your next step is to increase that resistance by placing a rolled up towel or blanket behind your knee to give that knee more of a resistance into a quad contraction. Try your best to keep the back of your heel down on the bed, couch, or floor so that you're getting a quad contraction while the knee is fully extended and not hyperextending. If your knee is having difficulty getting that full extension, or you're having trouble keeping it down, you can use the other leg on top to lock it in place. If you're finding your knee is really restricted going into straightening, you can use a heel prop with the quad set, placing it up, furthering that extension stretch that you'll feel probably in the back of your knee. If you feel a stretch in the top of your knee, you likely need some manual therapy, so reach out to your movement specialist, or make sure you let that physical therapist that you're working with know that you have some restrictions there. If not, work through this exercise, try to get your 5-second hold, contract that quadricep as much as possible, pulling the heel down into the floor, pulling the toes to the nose. Work your way through about 20 repetitions. One of the biggest problems after surgery is the amount of swelling that gets trapped in the knee. A lot of people will use ice, but the only way we can truly rid our body or help our body rid of the swelling is by getting a muscle pumping. When we pump the muscles, it helps the lymphatic system move the fluid out of the area. So as you can see here, I'm doing repeated muscle contraction of the quads. Work your way through about 30, 40, 50 repetitions multiple times per day. For more of a quad activation, you can hop onto your stomach, keep your toes down on the table, bed or floor, and try to go into that full knee extension, tightening the quads. As you can see here, I'm doing both legs at the same time, but you can certainly do one leg at a time to focus your efforts on the injured or post-operative leg. If you've watched any of my other videos, you know it's all about getting back to function. So we're moving this quad set into standing, using some resistance from a ball. Here I have a inflatable basketball behind the back of my knee, and I'm just trying to take that knee into full extension, much like it would when we go through a normal walking cycle. Hold that contraction 3 to 5 seconds. Repeat that 20 repetitions, and you can try it with increased resistance, moving that knee through different positions, pulling it gradually away from the wall.
Remember, my channel's mission is to cut out unnecessary surgeries, but in case you have to have knee surgery, now you know how to master that all-important quad setting exercise. Make sure you subscribe to my channel to help me on the mission. If you want to feel, perform, and live your best, you gotta move your best. Keep it moving.